When a person gets stroke, the neuronal connections in the motor cortex gets damaged. So what happens is that the patients lost control of their finger movements. But they can still think of those motions, which we called a motor imagery. So we tap into those signals in the brain, and when they think of the movement of their hand, we can decode it using the computers, and then we can instruct the robot to move their fingers for themselves. And then by this process, they get the feedback of how well they are doing in their therapeutic exercise. So this helps them get motivated throughout the therapeutic process, and gradually the neurons around the damaged areas form new connections to relearn those lost motions. So currently there are a lot of shortage of expert therapists and specialist care for the patients who are discharged from the hospital and in the community care. So this technology will enable them to do the therapy sitting at their home while connected to the physiotherapist remotely through mobile apps and other telerehabilitation mechanisms. That's why we are trying to bring down the cost so that it can be more affordable. For example, we are using very low-cost EEG devices, and also our exoskeleton is 3D printable, so it's much cheaper than the existing solutions in the market. So before the widespread rollout, we need to get clear answers on the acceptability, usability, and the clinical effectiveness of this technology. So how we want to approach this problem is that first we will conduct some public and patient engagement and involvement activities to get their feedback, and then we will go for small-scale pilot trials before going forward towards the large-scale trials. And once we get the results, we'll fine-tune the technology and make it ready for the home-based telerehabilitation applications.